Struggling to remember the heart murmur, let us understand it in 60 seconds. A heart murmur is defined as the abnormal sound produced by turbulent blood flow of the heart. The classification of murmurs are systolic, diastolic, and continuous murmurs. Systolic murmurs are classified as early systolic, that is, seen in ventricular septal defects. Mid-systolic or ejection systolic murmurs are seen in aortic stenosis and pulmonary stenosis. Late systolic murmurs are seen in mitral valve prolapse, and pan-systolic murmurs are seen in tricuspid and mitral regurgitation. Diastolic murmurs are classified as early diastolic murmurs seen in aortic regurgitation. Mid-diastolic murmurs are seen in mitral stenosis and tricuspid stenosis. Late diastolic murmurs are also seen in mitral stenosis and tricuspid stenosis.